Myself Yas Puksari. I'm from the Marwad University, student of second year BPT. My topic is pathophysiology of the atherosclerosis. What is atherosclerosis? Atherosclerosis is caused by the plaque fatty deposit build up in the arteries. These deposits are made up of the cholesterol, fatty substances, cellular waste products, calcium, and fibrins. It is a chronic inflammatory disease of the arteries and is the underlying cause of about 50% of all the death in the Western cities. Now, here we will see atherosclerosis, which is caused in the artery. So, we will see the layers of the arteries here. Here we have mainly the arteries is made up of three layers. The first is tunica externa, the middle one is the tunica media, and the inner one is the tunica intima. Then, how the atherosclerosis is initiated? The initiation of the atherosclerosis, the endothelium injury, hypertension, which is due to the smoking, hyperepidemia, lipidemia, increased permeability, and leukocytes addition. Second is the lipoprotein infiltration, the LDL, entry into the intima, oxidation of the LDL, pro-inflammatory molecules. The third is the inflammatory response, the monocyte recruitment, macrophages formation, foam cells development, cytokinin release. Fatty streak formation, first visible sign of the atherosclerosis, composed of the foam cell and T lymphocytes. Plaque formation, plaque progression, smooth muscle cells migration and proliferation, ECM deposition, collagen in elastic, fibrous cap formation, plaque destabilization, continue inflammation of the degeneration of the fibrous cap, risk of the plaque rupture. The risk of the thrombus formation, myocardial infarction or stroke. Due to the atherosclerosis, the complications are the thrombus formation, which leads to the myocardial infarction or strokes. The calcification, which causes the vessels rigidity and aneurysm formation. The risk factor of the atherosclerosis are modifiable. The first is smoking, hypertension, diabetes, and dyslipidemia. The non-modifiable are age, gender, genetics. So here is the flow chart of the pathophysiology of the atherosclerosis. We will see we are able to see the hyperlipidemia, hypertension, smoking, diabetes mellitus, immune mechanism, hyper factors, etc. are the responsible for the atherosclerosis. Now we will see the line by line. First, the endothelium is injured and dysfunction, which increases the oxidative stasis, and the adhesion molecule will increase the expression. It also increases the cytokine production, increases the DAMs, increases the PRRs, LRRs, inflammation, clonal homotopes of the undertone potential. The first will be the oxidized LDL lipid accumulation. Here we will see the first is the oxidized LDL accumulation. From this, it goes to the extracellular lipids. From that, it causes foam cells, macrophages, stimulus, and in the reverse also we can see this monocytes and T lymphocyte adhesion and immigrated into intima, which causes the foam cells, macrophages, smooth cell, modifies smooth cells. Now this is the smooth muscles proliferation, modulation, and plasticity, which also causes the foam cells. Now at the end, the apoptosis and the pyroptosis, which causes the atheromatous plaque, and from here we can see the collagen elastin, which causes the atheromatous plaque, which in turn causes the HDL into the cholesterol efflux. So this is the atherosclerosis of the pathophysiology of atherosclerosis. Thank you.